Good evening, everyone. Welcome to the August 11th Board of Health meeting. It is 6:31. I'll call the meeting to order. The first item on the agenda is review of minutes from April 25th. Everybody had an opportunity to look at those minutes?
Yes.
Yep.
Do I have a motion to approve?
I'd like to make a motion to approve the last meeting's minutes of April 23rd, Wednesday.
Second that.
All in favor?
Aye.
Passes. Next on the agenda is discussion interview of the health agent candidate. Do we have a resume for this candidate? By chance?
Not have a copy of that.
Okay, all right, you may have it. I think we even type over if we're going to use what out. One. So now we open up.
Hi.
Hi,
Meet everyone, I'm Alicia.
hi, Alicia. Thanks for coming in.
Thank you for having me.
Absolutely. Just for reference, my name is David Greenbaum. I'm the chair of the Board of Health. This is Jim Stepanian and Rudy Ann. They are members of the Board of Health. We'll have a few questions we'll ask you and have give you the opportunity to ask us some questions. All right. So why don't you start by just telling us a little bit about yourself, describe your interest in this position and any experience you have in similar positions.
Yes, so I had graduated with my master's degree in public health with a specialization in policy and management of December 2024, so not too long ago. And while I was completing my master's degree, I also was interning for the Connecticut Department of Energy and Environmental Protection. And I also worked at an oral surgeon's office as a patient care coordinator. So I feel that I offer a unique blend of environmental and public health initiatives as well as knowledge. I find that I'm a very empathetic and analytical individual, a huge perfectionist as well. Yes. And I am very interested in working for the town of Groveland. If I'm pronouncing it correctly, please correct me if I'm wrong. I find that the community is very close-knit, and I find that I thrive well in those scenarios.
Are you from the area?
I am actually from Connecticut. I had somewhat recently moved to Worcester with my fiance. He works in Boston, and we actually just recently moved to Boxborough. So I've also been working as a health inspector for the town of Westminster. And that very much closely aligns with this position.
So can you tell us a little bit about your knowledge of the work local health departments do and your background and knowledge of the state sanitary code and Title V?
Of course. So I actually just also completed the certificate manager position, exam. So I successfully passed that. And then I had planned to sign up for the Title V soil evaluator certification, which is that 2-week course, I believe, in the state of Massachusetts. I feel that my work does closely align with septic systems, private wells. During my master's degree and internship with Connecticut Deep, I created this infographic here, which you're more than welcome to pass around, which likely highlights and advocates for firefighters and PFAS exposure, as well as an additional exposure pathway to PFAS through the drinking water, primarily fire departments situated on private wells. So I would say I am quite familiar and still familiarizing myself with the 510 housing codes as well as the food codes in the state of Massachusetts. Thank you.
How long have you been working out with Westminster Board of Health?
Since July 1st.
What other additional learning and training do you think you need to do this job?
I believe that if I also, ideally, I would love to become a registered sanitarian, which is one of my end goals, of course, within the next coming years, as well as get my Title V inspection certification. Ideally, I would love to pursue my postgraduate degree and get my doctorate degree. But I am very passionate about working and providing for my family as well. And the community too.
Can you tell us about a time in your professional life or your college, in your education where you wish you could have had a do-over and what you learned from that experience?
Good question. Well. let's see.
If there is one.
Yeah.
Yes, that's a wonderful question. I'm very proud of being able to work and pay for my college and my schooling. And I do feel as I've been a very, I have a strong work ethic. So I've always been working sometimes 3 jobs while maintaining very good grades. So I sometimes wish that I didn't have to work like the 3rd job in order to be able to pay for school. But I'm very proud of where I am with that.
Where did you get your MPH?
I did that through the University of Bridgeport, University of Goodwin, and it was all online, which I was very fortunate to have saved gas money in that sense. Yes.
Can you describe your experience with coalition building and working across a range of stakeholders and their interests?
Certainly. So with my time at Connecticut Deep, I worked alongside many professionals and various stakeholders. For example, the Clean Water Action and advocating for clean water, primarily, especially related to PFAS. I think that's a very I would say, how do I want to word it? A newly researched area that I do think deserves more attention. I'm also considering signing up for the Boxborough Water Advocacy community because we do have PFAS in our water actually. So I've been very persistent and very looking forward to seeing how I can best contribute as well.
Okay.
Yes.
Can you share any experiences you've had with project management and tracking and reporting on progress towards goals or implementation?
I'm sorry, I missed the last part with
On reporting on progress towards goals or implementation
tracking.
Yeah. On a project or a project management that you've been working on?
Of course. So with food inspections specifically, I am tracking in Excel exactly when the next food inspection needs to occur, or for example, like if a food establishment has a critical violation, when I would need to follow up and be able to document clearly and make sure that I meet those deadlines with that.
Could you tell us your availability for work? Like,
Yes.
if we were to offer you the job, when you would be available?
So I would be available, I would say within 2 weeks. And this is a 17-hour position, correct? Which I did actually have a question too. In the foreseeable future, would it potentially have an opening to become full-time?
If I had my way, it would be full. But there aren't any guarantees, in all honesty. We are a small town and the budget is very tight. And as much as we would all like to see it be full-time, do we foresee maybe an increase in the number of hours? More than likely, but it probably wouldn't be like a 40-hour-a-week job for a while. Yeah. So
Okay,
would that be a hindrance for you?
not at all,
Okay.
not at all.
If you had to work, off hours occasionally, would that be a problem?
Not at all. I'm very happy to.
Right. Can you describe your experience using Microsoft Office software? Do you have any issues with Word, Outlook, or anything like that?
No,
Are there any other skills, traits, or experiences you would like for us to consider?
of course. I have my personal watercraft certification. I was a Marine Patrol officer for, I believe, 5 years, 4 years, maybe, I think, around that. So I do have a lot of experience working with communities. I also, what isn't listed on my resume, but I was also a professional nanny for a naturopathic physician who was also a Lyme literate physician. So I do, I'm very knowledgeable, as well as in combination with my degree on tick-borne and or vector-borne diseases and illnesses. Yes.
Thank you. And I guess my last question for you would be, do you have any questions for us?
Yes. What is some of your most challenging public, or one of your largest public health challenges that you see? Maybe top
That's-
3.
That's on her, basically, if I'm right. Anita deals with that stuff.
Well, as you probably know, the public health nurse position in most towns and cities, although there are many of them, as the bigger you are, responsible for safety and surveillance and control of infectious diseases and risks to the public. So in the state of Massachusetts right now, we monitor close to 100 various ailments and illnesses that are graded from no follow-up necessary to get on this in the next 24 hours or we torment you to death. So that's the sort of stuff we do see a good amount, not a lot. It's proportionate to the population, which is about 6,200 folks in the town right now. About 2,000, slightly over 2,000 of those are over 60. So we have a lot of senior issues. I work pretty closely with the Council on Aging on matters of health and concerns for the elderly population in town.
Wonderful.
So that takes up a lot of my time. Food establishment stuff and all of that other stuff, fortunately, is not on my table, but I work closely with the health agent in any matters that he or she feels requires my attention. So
Wonderful.
I look for a collaborative relationship there.
Wonderful. Thank you.
Sure.
And I think from an environmental standpoint, probably septic and Title V that's the biggest part of the job. So having a solid knowledge of soil evaluation, septic systems, private wells, things like that would probably take up the bulk of the time of the person that we decide to hire in the position. So, yeah.
Wonderful.
So this is your time to ask us questions. Fire away.
Yes. Let's see. Did. I brought them.
Yep.
The other thing is too, I've been on for 2 terms now, and we dealt with COVID a bit. And then this lovely guy decided to come help us, and we've been awesome to have him because of what he regular job is. But a lot of the stuff we did basically was variances for septic systems,
Right.
basically. And then this lady takes care of everything else, right?
And there's also like small town complaints, like trash and recycling is
Right.
always.
But that's off our shoulders now, isn't it?
Yeah.
Not yet. Not-
Yeah, yeah, well, that's been, big.
Not completely, but
I'm just trying to describe my experience being here, I guess, 4 years now as a volunteer. So just, that's been my experience and what I've seen on a table or meetings that come, stuff that come before us. I never knew what Rosemary did for sure, really, but Rosemary's not here but this guy's got it all.
I do it on a full-time job, so I know exactly what the job entails. I don't do a lot of Title V. That's the only drawback because my community doesn't have a lot of Title V, so.
Okay.
Is that because they're all on sewer?
Yeah, yeah. So here in Groveland, it's about 50-50,
Okay.
maybe 60-40, but it's a lot of septic, so. I think that would be the biggest challenge environmentally speaking,
Okay.
so.
To do those inspections and
Of course.
overseeing correctly.
Of
Because
course.
I always feel kind of strongly, some of these houses are being sold. And I don't want the person that's buying something to get stuck with something we missed or something we did wrong. So
Correct.
Rosemary has always handled that so well, and it's just sad she's gone, but I understand, but you need to protect the residents. That's what you have to do. You have to have the skills and the knowledge, and you have to know how to look at what's this guy is putting in the ground and make sure it's gonna work. Basically, that's my opinion of what Rosemary was kind of doing. And she took classes all the time too, extra classes. It's
Wonderful.
awesome.
Wonderful. That's my goal too.
So if you don't have any other questions, we're in the very early stages of trying to fill this position. Starting interviews now and it'll be open until it's filled, but you'll hear from us one way or the other. And we'll be in touch hopefully soon.
Wonderful. Thank you very much.
Thank you for coming.
Thank you for coming in.
Enjoyed listening to.
How long did you get home?
Not too long. I would say about 40 minutes.
Foxborough?
Yeah, Boxborough.
Girls drive fast.
495.
I mean, if there's no traffic. like-
Yeah.
Yes.
Shouldn't be too bad.
Glad it's not a Friday night.
Thank you all very much.
Take
Thank you.
care.
It's very
Thank you for coming in.
Very nice to meet you as well. Thank
Good
you.
luck.
Thank
Yeah.
you. Bye-bye. Thank you.
Thank you. Very nice to meet you.
Thank you.
Thank
Appreciate it. Take care. Good night. Want the job anymore.
Oh.
She's way ahead of me, just like you.
Just got some experience, a little bit of experience. All right, moving on. The deed restriction, what is this about? Federal car, restriction.
Who's putting this in our face? Department of Environmental Protection.
Well, I think it's the seller of the property.
Does it make everybody's life better or does it make it worse?
Well, it requires that the property stay as a 3-bedroom home forever and in eternity unless they can find a way to upgrade the system to make it more bedrooms.
There's nothing wrong with that.
my opinion.
He used a lot of words to do it though.
Is that also called a covenant? Is that a old expression or? I mean, isn't that the standard, like so many bedrooms per septic system is a standard now, or
I mean, Title V has always dictated that
that,
it
yeah,
has to have, it's like 110 gallons per day flow rate per bedroom. So if it's 3 bedrooms, you can't go over 330 gallons a day, and if it's 4, I can't go over 440.
So it is deeded as a 5-bedroom right now, but this will,
Yeah.
Mm.
Restriction granted hereby restricts the total number of bedrooms in and upon through
to
over
3.
and under, yeah.
The original deed being 1946, so some things have changed since then, right?
Title V,
I wouldn't-
Yeah.
I wouldn't-
there was no,
Yeah.
there were no restrictions right back then.
Yeah, so I mean,
Yeah, Title V is relatively new
Mhm.
within the last 50 years code.
So I don't have Rosemary to ask what she thinks of all this. I wouldn't complete about this.
I mean, I don't necessarily have an issue with it. I don't suppose Deb Ketchin took a look at this by any chance, did she?
She did not. Um,
We,
That
I mean-
sounds like a good idea. Dave.
yeah, I'm wondering if we can just make a motion that we'll approve this. If Deb looks at it and
Sure.
thinks it's fine.
Yeah.
Makes sense.
I'm okay with that, not having a ton of Title V knowledge. I'd like somebody that does take a look at it. Just,
I'll forward that on to her.
Do we need to second that?
yeah, I'll make a motion that we forward this to Deb Ketchin for review, and if she approves it, that we'll go ahead and sign it.
Mhm.
I second that.
All in favor?
Aye.
All right. So the next thing up is the memorandum of understanding between Groveland, or possibly between Mass Health Officers Association and the Town of Groveland. I had a conversation with the tobacco control director at MHOA regarding the possibility of entering into this MOU for the remainder of the year. I think it's FY 26, so it'll go until June of next year to offer tobacco control services that would include inspections and compliance checks to make sure that our tobacco retailers are not selling tobacco to anybody that they shouldn't be. And I have forwarded to Rebecca to send to town council so that they can review it and make sure it's okay with them. If they have any concerns or questions or want any updates, they can provide that feedback and then they will incorporate it. But I just wanted to bring it to the board for discussion to see if anybody has any questions, qualms, or.
I have no qualms about it, but what is the reason you are suggesting it? Not to criticize or anything, but
Well,
educate.
so the town used to be involved in a tobacco control collaborative many years ago, but it has been shrunk down. So currently Groveland, Georgetown, there was, I think it was 16 or 18 communities in the Merrimack Valley were part of this collaborative.
Mhm.
That would only cover some of the larger ones, Haverhill, Lawrence, Lowell maybe. But it doesn't incorporate the smaller ones, Groveland, Georgetown,
Let's do it.
West Newbury. But I guess Georgetown reached out. Our PHE, Public Health Excellence Group, put me in touch with them because they were looking for communities like Groveland and Georgetown that might be interested. Georgetown actually just had a pretty interesting case. A smoke shop right in downtown Georgetown that was actually selling marijuana-based products. And
Oh my God, you're right, yeah.
tons of THC stuff.
Wow.
And they were selling to minors left and right.
Yeah, do
They
this.
went to court over it. And these guys
Do this.
they got fined and, they got suspended sentences, I think. I don't remember the
Wow.
whole outcome,
I
but
didn't even
they had to pay
realize.
big fines. They could have gone to jail for it.
Hmm.
So,
Wow, yeah,
you know, they may want us to update the town regulations, to come into, alignment with state law, which I don't think is a bad thing. You know, fines are very hefty. If you sell to a minor, first offense is $1,000 fine, second offense is 2,000, and third offense is 5,000.
shut him down after that.
3-day, 7-day, 30-day suspensions. So,
No,
if the board is comfortable with it, I'll send this to Rebecca
I am.
and, she can send it to town council for review and then we'll go from there.
Yeah, that protects a lot of people. That's a good idea. Thank you, Dave. I get it now.
All right,
Thank you.
Anita.
Hi.
you're up.
Oh, my goodness. Okay, highlights from the last quarter. I would like to, for the record, start with, a mention, of we had an interesting sort of mini super spreader event following the 428 town meeting. COVID super spreader.
That's
It started out with just a couple of people coming in asking for, do we have any good tests?
Yeah.
We didn't, of course. And then, a few people actually did say, I went to the meeting 3 days later, this. So it was on the social media, they were coming into the office and they were also talking to like, the TA's office. So, I want to thank, Annie for her help in this. The stuff in our office that we could gather in terms of people who actually took a test. And told us that they were sick and then they got better and whatnot. So we kept numbers. We also did a sketch of the, I don't draw well, the room that they were in for the vote. And put it in quadrants. And we know that the index case was a worker at the sign-in desk. And we know who these individuals are here, And-
Excuse me, where's the front?
right here.
That's the front.
Yeah.
All the boards and everybody was,
We're
okay.
hitting here. Yeah, it's just like the
All right, all
room
right.
over at Bagnall.
Just need to get.
Okay, the mics.
Thanks.
Okay, there was one person on the actual board of selectmen that contracted it. But there was quite a cluster here. Nobody was hospitalized. One person had maybe a week longer than,
You know, what's the new variant Stratus?
no, it probably wasn't. It was probably the LP
Yeah,
before the Stratus came out. Following the PCRs from the emergency rooms, there were none of those cases or any other cases in that same time frame that were reported. Those are the only things that get reported. This was all hearsay.
yeah.
I didn't test, but I'm pretty sure I got it, kind of thing. So as best we can tell, and again, for the record, I just feel it's worthwhile to say we took it seriously and tried to study it, is that we had about 18 cases, and we stopped looking at them on May 19th. That was the finished period we would expect to have had any new
Right.
reports. As best as we can ascertain, there were 18 cases with the known index case near the entry and socializing with a lot of people before the meeting actually started. So we can pretty much put that little puzzle together. So that was an interesting exercise. And it also reminded people that it's still around. If you're indoors, you can still have a problem. Not to panic. It could have been flu. It could have been human metapneumonia virus. It could have been
Right.
RSV. It could have been any of those. So just because it was a COVID variant, it's nothing to get terribly excited about at this stage of the game. So we reminded people that, just try to be careful and, carry a mask with you. If you have any doubts, slap it on and wash your hands and just do all the same things we did to make it go away the first time. So I wanted that to be on the record. I thought that was an important thing. And a week later, I know personally of a wedding in New Hampshire, there were 35 to 50 people and 15 got it. And it was largely an outdoor wedding,
Wow.
but they were all
Must have been-
sharing beer bottles and stuff like that. So there was a lot of, There was a lot of partying going on. So that was another mini cluster around the same time. So it was active in the early part of the summer. Our bulletin board, we upkeep it. And so we're watching those botulinum cases associated with cosmetic Botox. We put that kind of information up on the board. The West Nile virus triple E updates. So far, so good on measles, but it's really something to watch.
Yeah.
Pertussis is also on a swing back, and hand, foot, and mouth disease. If nobody's ever seen that, that's really obnoxious. And it's hot right now. And I don't know if we have a splash pad yet or anything like that, but that's a very common source of sharing infection, splash pads and kids sharing
Do we
things.
know if that's been built?
I don't know. I don't ever go down there. I'm afraid of
Neither
it.
do I.
I'm afraid.
I have not, we do a lot of sports down there and I have not seen anything outside of the dog park, so.
I just want to know what they're doing with the water. Are they filtering it or are they
Nobody asked us. I don't know.
letting it run off into the drain? Because if that's what they're doing, I really don't care about it. But if they're filtering it, then that opens up a whole new can of worms.
So we need our health agent to inspect that. So why don't we send Deb down there?
What about can we send a note to the recreation committee, just inquiring? Or just a conversation with
I'll ask them.
Mr. Dempsey?
I'll ask
you might know.
Rebecca when I,
This-
Yeah, I don't know. I know it got, I think it's got grants and approvals and we don't have direct stuff with it, so I just keep waiting for new things to pop up from time to time and whatnot, so.
I'll address it.
Okay, all of our Maven case reports are complete, and have been submitted, nothing, a couple of interesting cases, but nothing, terribly concerning. The Region 3 EMR framework that, I came in late on, Rosemary was, worked on that, and we went to that, meeting for the hone down of whose responsibilities are what. They sent out the comprehensive plan to us. I have forwarded that to Chief Gillen to be attached in terms of who the responsibility specific to the Board of Health to go into the comprehensive plan for the town. I've read the water quality result or the brochure that they've sent out, and those P things are temporarily gone in this exam. And
Okay.
at least, well, that little minuscule update that causes a water district, treatment plant is suddenly not there this quarter. So at any rate, I reviewed it and it's in concert with where you would expect everything to be. I have an article for you guys, just not that you are terribly interested, but it's on Plan B for epidemics, for epidemic preparedness, where we're going, and it's based on statewide, just for over. It's just an FYI of interest.
Yeah.
I'm not sure we can depend on the federal government or FEMA or anybody else at this stage of the game. And the level of brain drain in the CDC and the FDA and everything else is of great concern, but we'll have some responsibility statewide if anything else pops up. So it was just an interesting article, and I just give it to you just for fun reading. The XFG variant, the Stratus has overtaken the LP 8.8, which is now number 2. It's got 2 distinct characteristics in terms of the symptoms, and one is that like a strep sore throat and hoarseness, which is not associated with any of the other ones. So that's a distinguishing. If somebody comes up to you and goes, "Oh, I'm so hoarse today," I'd be heading out the door. But if they don't, you're not any sicker with it. You don't have to go to the hospital. It doesn't carry any of the attendant worsening symptoms. It's just those 2 new little things. So we were watching for that. The dose of the last COVID booster should carry enough of the protection. And I'm hoping that we'll get some this year, that enough will get made to distribute.
Great.
So that's encouraging. And there are two more antivirals that are available now for treatment. And that's an encouraging thing. We didn't have that for COVID either. I mentioned the ban on the kratom, and nitrous oxide. I was stunned at how many people are concerned about that. I was like, what? And, one of the people that does sell cigarettes or has a business that does sell cigarettes, she can't keep those little tins of, it's like a little pouch.
Zin.
ZYN, is it?
Yeah.
She said she can't keep it in and young people are buying it.
Yeah.
So that's just another thing.
It's really sad.
It's very sad. I'm almost done. Let me look. That is my supporting documents. We have, 2 flu COVID clinics scheduled for October. 10/14 and 10/28 between 10 and 12. It will be open to 18 and over. It's a joint between the Board of Health and the Council on Aging is going to be helping start with the processing.
Registrations.
Yeah, and it's, we're partnering with Laterno Compounding Pharmacy in Andover. No fees,
Wow.
no pre-registration required. They're bringing their administrative support staff. I'm really happy with this deal.
How did that happen?
They're just, committed to getting this done. It's a small scale thing.
Did you start that?
No, that's their business, but, I found out about it and I followed up on it this year.
Thank you.
I had already committed to Rite Aid last year and somebody had mentioned these people, so I followed up on it this year. That's an anticipated savings of about somewhere between the other ones. If you didn't have more than 20 an hour, then you got a $100 pharmacy charge for that. So there's none of that going on. So we were willing to spend around $300 last year for
Right.
penalties, but there's none of that. They will stay an extra 2 hours if there's a line
Wow.
for each of the clinics. So, I mean, you don't get that kind of customer service. So,
No, that's awesome.
yeah. So, I was thinking, we had mentioned at the last meeting when Pam was talking about babies and all of that kind of
Yeah.
stuff. We haven't talked about that since, but I got thinking about other reach outs that we could do as a Board of Health that talk about prevention and care and resources. So the American Academy of Pediatrics has what they call 8 tip sheets from newborn to 10, the age of 10. And they're in the form of 8 tips in those categories. You can buy a pad of those of 100 for $27 a piece, basically. If you buy them all, 8 of them, so that's 800 total sheets, that's, but 8 categories,
Right.
it's $155 for all of them. So, if you added $50 for postage and $45 for mailers, I went and got a list of all the births and deaths from 2000 to 2024. We asked C about 50, 55, 50, 57, 42. So between 45 and 55 births a year in this town. So I was thinking if I could put together an introductory letter, welcome new baby from the Board of Health, we're here. And then add the age appropriate fee. And there's even this 211 emergency line for maternity depression. You want to put the kid in the car because you're going to hit them or something like that. Childcare centers, preschool programs, ADHD help, stuff like that. You put one of these in there and just make a welcoming packet with information in it. It would cost us the cost of all of that, which would get us through about 2 years, I see, unless we can copy it. I think we probably could. I don't think they would mind if we made
So
copies.
I'm fine with that, but I am gonna suggest that you talk to Pam if the regional group is gonna do like the mother visiting thing. And she's willing to do the visits, it may be worthwhile to include that information in whatever you send out.
Yeah, I mean, like I said, I haven't heard from her except over another issue completely apart from that. Since then, and I don't know any of the other girls on the 113 strip that are doing anything new or different either, so.
I know West Newbury is still hemming and hawing about getting involved in the grant, which I think is a shame because it does offer a lot of benefits. Really for nothing. There is no financial buy-in from the town. And they get a lot of, not financial benefit, but they'll get a lot of resource benefit out of it.
All right, so what I wanted to do, I thought this was a not, with the potential expense of
Yeah.
the cost-oriented clinics, we say that's money I wouldn't have spent this year, but if I had it, I could invest it in something to start off an interrelationship between the Board of Health and newborns. Kind of
I'm
thing.
fine
I don't
with
think
that.
that's it's not to replace that, it's just
Right.
along those lines, a helpful thing. We're here. I know where you can get help. If you want to call the office, we can get you help,
Right.
you know, kind of thing, or we can answer your questions, or this or that.
Yeah,
Um,
absolutely.
I loved it.
and I'm particularly concerned, not for the people that have means, but for the single mothers. I didn't need to look at you when I said that. I'm sorry, it just went.
I
that
mean, if
way.
it helps one person.
If it helps one person,
Yeah,
but we have young unmarried women who have babies and they're struggling, and this is
you have teens that get pregnant and have.
Yeah, and they have nowhere to go.
Or you know what, you have you have couples that are married and they have a child and the mother is struggling and they need help.
Right.
So I support it, so.
Okay,
So do I.
all right, so, if I could get an okay for spending no more than $250 of this year's budget for these supplies. And I didn't want to commit to Pam or anything else. This I can manage, not a problem. It's up to me.
I'm fine with this, but again, I'm just gonna suggest.
I would make an I'll make a
Just
call to
talk to her
Pam.
because they may have some other resources that they can
Exactly.
give you.
That could be added in this.
Yes.
Better.
But I also would like to have a follow-up conversation with her because the last one was just all over the place and I really couldn't grab a hold of what
Yeah.
she was trying to say.
And they may not be
It's all
doing
over
this
the
yet.
place.
They may not be ready to do this, but I know she was one of the founding members of the Mother Visiting Group when she was in Newburyport.
Okay.
so,
Yeah,
Um,
and I know there's some Lawrence or Lowell big group out there
Yeah.
that I don't, I mean, I just don't have interaction with that kind of thing anymore, so. I promise you, I'll definitely give her a call, but with the turnover that we've had and the change and stuff like that, it's probably not a good time to,
Let's do it for Groveland people.
dig in. But, I do want to have a clarifying and at least closure on that subject one way or the other.
Right.
And so I promise, I assure you, I will reach out. when I
Yeah,
get that.
I'm fine with it. If you think you need a motion
So-
for it, then we can make a motion.
I just, we have some monies, we've got, everything in the office looks good, don't you think? Except for the candy, which, not a problem.
I'll take care of that. I'll go to the
So,
Jen's. You want?
I can't think of any other, I don't need any supply, I don't need blood pressure cups or anything, I don't need any supplies. And our syringe stuff is like going gangbusters. The Ozempic GLP-1 use alone we've already had an interim pickup before it was due because the box was bulging. So it isn't just the usual insulin syringes and stuff like that. It's like these gigundo boxes of these Ozempic things, and Lovenox and stuff like that. So
Right.
we're getting a little bit more usage. So right now I can fit probably 6 more of those big containers in my box. And they left another one next to us, so we have it. But I'm not sure if we're gonna have to add an extra pickup for next year. So $75, that would be an extra cost.
Yeah, okay,
Over,
good to know.
so just to let you know, the trend is going up.
Yeah, so
And
we'll
it's
just
largely that.
monitor it for the
Okay.
rest of this fiscal year and then we'll see what the cost is. If it goes up significantly, then we'll have to look at that
Right,
as
right.
we go into budget time.
I keep track of it. I have a manifest and keep track of it, so. Other than that, I'm done.
All right.
I don't have much else to say.
Thank you, Anita.
The only thing, we've had a meeting since April. I think that was Rosemary's last meeting, so I do just want to say, she did resign in June. I think it is a loss for the department. I think it's a loss to the town, so I just want to make that public statement that, I wish Rosemary well in all her future endeavors and,
I'll second that.
It's unfortunate. that
Yes, it is, that we lost it.
Yeah. So there's that. And, I don't have anything else. Does anybody have any other topics of conversation or things they want to discuss?
I make a motion to close the meeting.
I second that.
All in favor?
Aye.
Aye.
I just wanted to say she's doing a great job.